This video has been created solely as a depiction of intraoral treatments by a qualified RMT of Ontario. It is not in any way to be considered instructional. It is assumed that your integrity guides you not to share, post, embed, copy, or use any content in part or in whole without first seeking permission from the video creator. Thank you. Once clients arrive, submit a health history for which assessment, treatment planning, and identifying contraindications is complete, treatment for TMJD begins with lots of neck and shoulder work. One of the fundamental concepts in massage therapy is that the client is in charge of how much pressure is used according to their pain tolerance. The mandible is directly affected by the relationship of how the head is held on top of the whole spine, and it is easy to find many areas of asymmetrical muscle tightness. One of the most important regions is the ridge at the back of the skull, to which many of the neck muscles attach. The first chewing muscle to be addressed is the temporalis muscle. Many clients are not even aware of its existence. Its tightness can exert very different loads on either side of the mandible and also play a strong role in restricting opening. Next is the power chewer of the mastication system, the masseter muscle. This is often the dominant region in which long-standing pain and tightness has accumulated, and the tightness can be very different from one side to another, directly affecting the mechanics of opening, closing, and occlusion. Treating the masseter muscle is often most productive and accommodating to clients if it is delivered incrementally, back and forth from side to side, left and right, challenging tightness and fascial elasticity issues. A very effective and important technique for working TMJD is a kind of partner stretch for the joint ligaments. A decompression mobilization is a very subtle joint gapping moment that also offers an invitation for a forward positioned articular disc to return to an improved location. This can have positive effects on repatterning the condyle disc relationship and further help reduce restricted opening. While working on one of the most important mastication muscles, the medial pterygoid, it looks as though nothing is going on. However, the client is very aware of the moments the muscle tightness is being challenged, and releasing this muscle's asymmetrical tightness often has powerful outcomes. Working the long accumulated tightness on the lateral pterygoid muscle also has direct influence on the anterior positioning of the articular disc. It is a technique that is slow and sustained. Once access is granted into that cramped corridor where it lives, assisted by the client moving their own mandible laterally, the idea is to hang out and wait for the release. Finding an RMT in your area is the first step in collaboration. Each of these websites offers a public registry. One is the Registered Massage Therapy Association of Ontario, and the other is our governing body, the College of Massage Therapists of Ontario.